Hello, hello, and welcome everyone to the Dr. Janine Show. I'm so happy to have you all here today. Please say hello and where you're from, and thank you for spending some time with me today. Now, we have a fantastic jam-packed show today, some new information that you have never heard before, I guarantee it. And of course, this is a very interactive show as well, so we're going to be playing some games. You have the ability to win a prize as well. If you're new here, please tell me where you're from. And yes, it is a very interactive and exciting show. We're talking about oil pulling today. If you know about that, last week we talked about how to identify a good or a bad coconut oil. So a little bit of a review on that. And who does oil pulling? I would love to hear. We're also talking about fake vitamins, what you got to be careful of, especially with fake vitamin B6. This is scary stuff that a lot of people simply have no idea about. As well as we're talking about fluoride toxicity. So we're all about spring detox. Happy spring to all of you. If you missed last week's show, we welcome in spring. Hopefully everybody's doing great and you're all feeling really well. And maybe you started a little bit of that spring detox, but we're talking about some toxicity concerns with fluoride. And this is some scary stuff in terms of medications and pharmaceuticals, places you would never believe that you're getting some fluoride exposure. And more importantly, we'll talk about how to mitigate some of those risks, of course. We're talking about leg and muscle cramping today as well, because so many of you were asking about that. And we will start off the show talking about those fake B vitamins. But if you missed last week, we talked about spring detoxification. We are toxic, and maybe it is a good time to start some detoxification. It's great to have you all here. Bazib, hello, nice to see you. Believe 338, you've been doing oil pulling for years. Amazing, amazing. I'm sure you have the whitest and the brightest teeth. We're going to talk about all of the benefits of oil pulling, which is amazing. Now, please let me know. I know somebody's here from Florida. Hello, hello. And Becky, hello, nice to see you. Leslie is here from beautiful Victoria, BC. How's the weather out there? I hope everything is great with you. Lim Singh Ju, hello from Malaysia. Nice to see you. Thank you to have you here today. Betty is here as well. Felicia, nice to have you here from Guyana. Thank you for tuning in. Okay, is everybody ready to play our quiz section? Now, don't forget that we also have our sponsors who sponsor the show, and they donate a prize every week. So, of course, we're going to be doing our quiz questions, so get ready for that because you got to be quick with our quiz questions in answering in the commenting section. I will also announce last week's winner, which is going to be amazing. Thank you and welcome in. Hit that share button, everyone. And if you're new here, if this is the first time, welcome on into the Dr. Janine Show. Of course, I'm Dr. Janine, naturopathic doctor, talking all things natural, how you can get healthier and do it in natural ways. And we have a different show topic every week. For those of you just streaming in, hello, Layla in Germany. Nice to have you here. LV McBride in Oklahoma. Carol in Pittsburgh. Nice to have you here as well. Is it Lois Ballantyne in Markham? Great to have you here. Thank you for tuning in. Okay, let's get started. Okay, with the fake B vitamins. So vitamin B6, I want you to check your vitamin bottles, okay? Because most of the vitamin B6 in the marketplace is fake. It's made from petrochemicals, and it has scary consequences if you're taking, and this has actually been found in the literature and in the studies, I'm going to show you some of that research, that it causes some serious problems with your nervous system, okay? So this is what you're looking for on your vitamin labels. Vitamin B6, this is an example, of course, when you're looking at a multivitamin. This is an example of the vitamin panel, and it lays out all of the different vitamins, okay? So what you can see here, vitamin B6, that's what you're looking for. If it says pyridoxine, or pyridoxine hydrochloride. That is the fake type of B6. Okay, so after the show today, if you are taking a multi, I want you to go and check your vitamin bottles. This is scary stuff because we have vitamin B6 receptors, okay? So what happens with natural vitamin B6 from our diet, it goes into that docking site onto the receptor. Everything is hunky-dory, everything is fine, everything is good. But with fake vitamin B6, that pyridoxine hydrochloride, it will sit in that docking site and have negative consequences, especially for your nervous system. And it will sort of gum up and trap up all of those docking sites for your vitamin B6. So one of the symptoms of taking the pyridoxine hydrochloride is a loss of feeling in your extremities. It's called peripheral neuropathy. Scary stuff. And this has actually been found in the studies. And this is something, if you want more information like what I'm sharing, I talk a lot about fake vitamins here on the show. Please hit that share button. Make sure that you are subscribed and you are following me as well. And I'll give you so much more information all about and really dispelling the myths about vitamin supplementation. There's so much misinformation out there. And I'm sort of the vitamin queen. I'm known as that. And giving you the goods, giving you the right information as to make sure that you're getting your nutrients in the right way, okay? So let's take a look at this research. Now, that pyridoxine hydrochloride containing supplements has gained a lot of attention over the past years as they have been related to the development of peripheral neuropathy. So you can actually look up this study yourself, read it, scary stuff. So for those of you, just think about this for a second. You're taking something, you know, your natural, what you think is natural. It could be even the very expensive type of multivitamin. You're taking it every day and you're thinking, I'm doing something good for my health, right? Well, if it's got that pyridoxine and the other fake B vitamins that I've talked about in other shows in there, guess what? It could be causing more harm than good, and now you're getting numbness and tingling, and then you're going to the doctor thinking you have MS or something, when really it's because of the fake multivitamin that you're taking. Yes, that's why I share what I share on my show, based on all my research and based on my years of work with my patients. And this is so important that you learn what is real and what is fake, and taking a good quality multivitamin from whole food sources might be the better way to go. And that's what, if you want more information about that, make sure that you are subscribed, you are following, and I certainly will give you all of those details. Thank you for all the follows. I see George and Chris and Betsy just followed right now. Thank you. I know a bunch of you are sharing, so I always appreciate when you share the shows as well to let more people know, and some of your friend base and your family, let them know what we do here every Tuesday at 11 a.m. Eastern Standard Time. We talk all things natural here at the Dr. Janine Show. Okay, so did you know, and this is really interesting, that your teeth, so if you've heard of reflexology, you know that your hands, the bottom of your feet are related to your internal organs. But did you know that all of your teeth are also mapped in traditional Chinese medicine to what's going on with your internal organs? Now, this is super fascinating stuff. I'm going to give you just a little bit of a tease, a little bit of a tidbit about what is going on here. We're going to look at the tooth meridian chart behind me in just a second. But guess what? I'm also going to be sharing tips for oil pulling. So if you don't know what that is, you got to stay tuned. But that's all about dental health. But as you'll see now, oil pulling can really help in terms of fixing up your microbiome in your mouth, pulling out toxins in the mouth, which we will talk about, and how to do oil pulling correctly. It can actually affect your internal organs as well. So look at this. So your teeth are mapped, and this is something that you can get this information. It's a chart that I actually just purchased online. So you can purchase this for yourself, but you can see that each tooth is mapped to our internal organs. So let's say I have an issue with my upper left tooth, okay, in the middle. So the first one from the midline, and that can be affecting my pineal gland, which of course could be affecting my sleep with melatonin secretion, my bladder, my kidneys, my lower back, even my feet and the backs of my knees and my frontal sinuses. Amazing. So imagine you've got a root canal. Maybe you've had some severe dental work done. Maybe you've got chronic cavities in these teeth. You can see how this is mapped now to all of your internal organs. So that's why dental health is really important. That's why we will be talking about oil pulling tips and how to do that properly. And if you don't know what oil pulling is, you got to stay tuned because that's coming right up. Now guess what? It is quiz time already. Wow. Okay, so every show, this is what we do live on all the different platforms, is that we have some quiz questions, and we have a prize that is donated every week from our great sponsors, VitaTree Nutritionals, okay? So whole food vitamins. This is their vitamin B12. Of course, doesn't have any of that stuff in there that I was talking about in terms of those fake B vitamins. This is a whole food vitamin B12 supplement. Okay, are we ready? This is what you're playing for, and this is quiz question number 1. So if you're new here, this is what we do. You got 30 seconds. Once that question comes up behind me, and you're going to have a clock. It's going to count down. Just in your comment section, you're going to comment whatever the answer is. Even if you get it incorrect, it doesn't matter, okay? We just want you to be participating. Do your best. Are we ready? Playing for that vitamin B12. Here we go. Quiz question number 1. What is the name of the fake vitamin B6 to avoid? You got 30 seconds on the clock. Okay, do your best. Everybody get your answers in. I know it's a long kind of word, but hopefully you're paying attention. What is the name of that fake vitamin B6 that we were talking about? Oh my goodness, some people were really paying attention. Jill and Michelle, I'm glad you're loving this. I hope you got your answer in. Just do your best. Just put something in, even if you don't know. Everybody who participates has a chance. Okay, 1 second left. Everybody get it in. Ooh, I stumped some of you, but I see somebody, a few of you had it correct. Dana and Natik definitely had it. Miels, Diana, TLC Pottery, Kina, a lot of you had it correct. Rainy Art had it as well. It is pyridoxine hydrochloride. Okay, awesome, awesome. Good job, everyone. Let's go on over here and continue today's show. Now, I do want to announce last week's winner of the VitaTree Vita Detox was Pamela Fair-Jones. Congratulations, Pamela. Awesome, awesome. You won the Vita Detox. Good job. Please make sure that you are following Team Dr. J9, everyone. So if you're seeing commenting coming from Team Dr. J9, if you do have questions and things throughout the show, that is my team behind the scenes who's working really hard to answer your questions. And of course, you have to follow Team Dr. Jane on some of the platforms so that we can actually reach you, so that, and make sure, of course, you're following me as well, that we can reach you so that you can get your prize and we can get your address and everything. Okay, now let's talk about oil pulling. Now, and we will also be talking, so if you were here last week, remember we talked about the emotions and how that affects our health? We're going to be talking about that as well and continuing that conversation and going through that emotional guidance scale. But here's something that's interesting when we're talking about oil pulling, and we know that this is the ancient practice of putting a certain oil in your mouth. So usually it's coconut oil. Some people traditionally use sesame oil, and you swish it around your mouth. And this comes from Ayurvedic medicine. And it's traditionally from India, and what it does is it helps to remove bacteria, helps to promote oral hygiene, helps with cavities, helps, and I'm going to give you a list of some of the things that it's, has been proven in the literature to actually help with, but also is really great at pulling toxins out of the blood that can be affecting the brain, which is really interesting. So let's talk about now, because now the opposite side of this, in terms of being something bad for your dental health, of course, is fluoride. Yeah, and I know that if you've heard, okay, we have got to do the fluoride, and you go to the dentist, and the kids are, and you've been, talked into maybe having fluoride treatments for your teeth. Not a healthy thing, okay? So I'm going to dispel some of those myths, and we're going to talk about fluoride toxicity as well and some of the symptoms of that. But let's talk about the benefits of doing that oil pulling in your mouth, okay? So one of them is, of course, and then you can screenshot this list if you have the ability to do it on the platform, is to help to reduce that bacteria and plaque in the mouth. And they've actually compared up oil pulling versus chlorhexidine. And look at this study. So oil pulling with coconut oil seems to have similar plaque inhibition activity as chlorhexidine. In addition, it caused less tooth staining than chlorhexidine. So isn't that interesting? And doing oil pulling actually helps to whiten the teeth. So this is actually been studied now. It's not just, some woohoo kind of practice that some people are doing. Oh yeah, I do oil pulling, but people roll their eyes. No, this has actually been proven in the science to actually help with what's going on with that microbiome, which of course is the balance of the good and bad bacteria in your mouth, helping with that with your oil pulling. Okay, number 2. Helps with bad breath. So if you suffer chronically with bad breath, you might want to try to do the oil pulling, and I'm going to talk about how we do that properly in just a few moments, so stay tuned for that. If you're new to this, you've never heard about oil pulling, then I'm definitely going to let you know how to do it. Okay, number 3, helps to reduce inflammation. So if you've got inflammatory issues happening with your gums because you've got dental infections, you're prone to bad bacteria in the mouth, we can see how those are correlated. Having, that healthy microbiome, again, with the oil pulling can really help with that inflammation in the gums. As well as number 4, helps to decrease cavities. Of course, if you clean up the bad bacteria, fix the microbiome in the mouth, it will decrease the cavities. So think about kids. I mean, it's so simple. I keep the coconut oil in our bathroom, and the kids just swish it around a little bit. I actually make my own toothpaste that has coconut oil in it as well, so they get the added benefit of that, which is amazing. But the actual oil pulling helps to really decrease those cavities. So less trips, hopefully, to the dentist. Number 5, actually whitens the teeth, which is amazing, as well as number 6, helps to detox aluminum and glyphosate from the blood. So if you don't know about glyphosate, it's something that I've talked about in previous episodes. This is something that's a herbicide that is in wheat products, corn products, and traditionally grown foods here. Really a lot, big problem in North America and other parts of the world as well. But that glyphosate toxicity is combined with aluminum, and we know that that gets into the bloodstream, crosses the blood-brain barrier, and now has an effect on what's going on mentally. So things like Parkinson's disease, we know that there's problems in terms of aluminum toxicity. We know that Alzheimer's disease, aluminum toxicity has crossed that blood-brain barrier. So this is more than just cleaning out your mouth and having nice white teeth. This is about our overall health and helping to actually detoxify toxins out of the blood, pulling that aluminum toxicity out of the body. And that's why the way you do oil pulling is really important. That's why I'm going to share my tips how to do that so that you're maximizing your benefits, not only for your spring detox and your detox in general, but also to whiten your teeth and to have, of course, less of those dental visits, which is amazing. Okay, let's go on over here. Let me throw that to you real quick. Oh, sorry. She caught it. That was good. Okay, so here we go. Let's talk about my viewer spotlight for the week. So every week I like to call out somebody who has been amazing in terms of your positivity. That's what we love here at the Dr. Janine Show, all of that positivity, which is all about good health. And this was from Cezia Marie, did I say that? Cezia Marie, I hope I got that right. I'm sorry if I messed up your name, but there you go. Thank you for your dedication and education. I have to say, the best followers on the planet, everybody who tunes in, and I know that you set your calendars, you make sure that you watch the show every week. Love you all. And hey, if you're new here, please make sure that you hit that follow button. Make sure that you are subscribed so that you get more of my great content, and that I can really help you on your health journey with the information and all the research that I do to really help to make this place a better and healthier place for all of us. Another in terms of my followers, which is amazing as well. And we do this every Tuesday at 11 a.m. Eastern Standard Time. So if it is your first time here today, make sure that you're tuning in next week as well, and we'll see each other again, and I will share all new topics next week. Okay, let's talk about, and this was, coming from all of you. So many questions that we were getting in terms of the commenting section about leg cramps and having a lot of pain in the legs. So this is something that I wanted to go through, some of my tips and some of the causes why we can get a lot of muscle cramping and achiness in the legs. And my tips for oil pulling are going to come up in just a few moments, so stay tuned for that. But let's start with what causes some of that cramping in the legs. Okay, number one would be not the best circulation. Okay, so this is something that if you are not as maybe active as before, maybe you're not moving your legs as much, and this is one of the reasons why exercise is so important, to actually make sure that we're related to your age. If you're overweight, that circulation can compromise that proper musculature, balance of your electrolytes and things. So this is important that we get some exercise, and that poor circulation is one of these things that can cause some of that muscle cramping. Okay, number two, poor diet. And when we don't have enough glucose in our system, especially for exercise, and maybe you've got diabetes, maybe your blood glucose levels are all over the map, they're not stabilized, maybe you've got insulin issues as well, this could cause some muscle cramping. Okay, number three is a big one, dehydration. So simply not having enough fluids in your system, really important that you are keeping yourself hydrated. And number four, which goes along with number three, mineral depletion. So you've heard of electrolytes. You know why athletes drink these electrolyte drinks? Well, it has a lot to do with balancing the minerals. So things like calcium, magnesium, sodium, potassium need to be balanced, and balancing those electrolytes really important if you are prone to that muscle cramping. Okay, so we will be talking about, and we're going to share that recipe for my electrolyte drink, which is all natural. It's what I give my kids when they're doing their sports. It's what I take when I'm exercising as well. Amazing, amazing. I'm going to show it to you because it's actually quite pretty. And there's kind of like a chemical reaction thing that happens when you do it, the way that I do it anyway. So I'm going to show you that in just a second. So, okay, let's continue with, of course, side effects of medications. So this is something that with medications that we have to make sure that we are getting and looking at some of the ingredients. So here's the thing, we're going to be talking about fluoride toxicity today. Yeah, toxicity from fluoride, absolutely. Hit that share button, please. Make sure that you're tapping your screen and that like button. I see all those love and the hearts coming in. Dora, thank you for all those hearts. Amazing, amazing. Awesome, awesome, awesome. Thing with fluoride, a lot of medications actually contain fluoride. So let's go and play a little game here, because I wonder if anybody knows this information. It's something that, a lot of people just simply don't know. And certainly I don't think your doctor is telling you that if you are prescribed with certain medications. I don't think your doctor necessarily maybe doesn't even know. Certainly the pharmacist would know. but maybe it wasn't always fully disclosed that you're ingesting more fluoride when you're taking these medications. Does anybody know? So please put in the comments if you know of any medications that contain fluoride or fluorine. Here we go. Hyatt, thank you for sharing today's live. Ruth, thank you so much. Thanks for all the new people that are here. We're talking about medications that contain fluoride, scary stuff, and we know that fluoride is definitely toxic to our neurological system. It has been touted as something that's great for our teeth, but the absolute opposite is actually true when you talk about, what's going on in terms of fluoride toxicity, and we're going to continue that conversation. Okay, does anybody know? Any nurses out there? Any doctors? Yes, Mary. So antacids are big for fluoride. Thank you. And don't be shy, all the doctors. I have a lot of followers now that are doctors, so don't be shy. It's okay. You're not going against your industry. You can share what has fluoride in it, even though we're saying that we know that fluoride is bad. But which pharmaceuticals have fluoride in them? Anybody else? Yes? Okay, Danielle Peterson, Daniel Peterson, realtor. You've got it. So we've got antacids. We also have cholesterol-lowering medications, so the statins. So I'll just put statins. I think most people, I'm not going to put any of the brand names for obvious reasons up on the board, but statins. So this is to lower cholesterol. Okay? Can everybody read my pen? Yeah, I am a doctor. I know. I've seen the comments before. Yeah, you write like a doctor. Yeah, I am a doctor. I'm sorry, but I try to be very good when I'm on the blackboard. Okay, here we go. Anything else? Anybody else know what else contains? Yeah, exactly. Queen for days. I know the kids' dentists always push for the fluoride treatments, and you just got to say no. That's what in my opinion, that's what I do as a mom. I just say no, thank you, no, thank you, because I've done my research. Help you here. I'm going to help it out. I don't see it yet. Here we go. Oh yes, Angela, I see it. Okay, yes, and Lee has some good answers as well. So let's go with antibiotics first. It is, yeah. Okay, there we go. So antibiotics. And here's a little hint, okay? If it says flu in the medication, that's a big indication that it's got fluoride in there, okay? So you can start to look at the actual generic names of your meds, and if it's got flu, then that's a good indication, okay? So antibiotics is a big one. A lot of people have really bad reactions to certain antibiotics. We know about the sulfa-containing antibiotics, but this is a big one as well. Like Fluclox is one of those antibiotics. Again, it has the word flu in it, has the fluoride, okay? So that's important. As well as, I think somebody else had it. Yes, Katie has it, antidepressants. So here's a big one as well. Let's see if my spelling is on point. Yes, there we go. So antidepressants. We have the other category here. Which one am I missing? Yes. Yeah, antifungals as well. Antifungals. And anti-inflammatories. So anti-inflammatories. Okay, so the drugs, if you're taking for your arthritis and things to help to decrease the overall inflammation in your body, they can contain the fluoride as well. I think I got all my list that I was looking for. There's a bunch more as well. Over 350 pharmaceuticals have fluoride in them. Isn't that scary? Oh yeah, crazy stuff. Okay, guess what? It is quiz time. So just take a look at this, and after this show, if you want to do more research, you can definitely do that, and maybe look up or ask your pharmacist if your medications do contain that fluoride. Now, more importantly, we'll talk about tips to detox fluoride. I think that's coming up actually next week, so you're going to have to tune in next week when we go through some as well. Guess what? It is quiz question number 2 time. Hello, everyone. Thank you for everybody who's tuning in today. I am Dr. Janine, and we are playing for the VitaTree Vitamin B12 from our great sponsors at VitaTree Nutritionals. Is everybody ready for quiz question number 2? All you're going to do is answer that question live as well. And if you're new here, make sure that you want more information like what I share, that you hit that follow button and you are subscribed. Okay, are we ready? Here we go. Quiz question number 2. You're going to have 30 seconds on the clock. This is an easy one, I think. True or false? Oil pulling can help prevent gingivitis and cavities. All right, you got 30 seconds on the clock. Get your answers in. I think this is pretty simple. Do your best. Here we go. All right, we've got about 15 seconds left. Everybody getting their answers in. All right, all right. Good job, everyone. Tony, Sandra, Mary, Blue, 99. Oh, Blue, 99. I like J9. Yes, that's good. Awesome, awesome. Okay, did everybody get their answers in? I think you did. Okay, perfect. Of course. Let's reveal. Of course, it's true. Yay! Congratulations to everybody who answered that correctly. We do have one more question remaining, so stay tuned for that. Let's talk about some of those symptoms of fluoride toxicity. So we just came from speaking about a lot of medications, unfortunately, so pharmaceuticals that do contain fluoride. And we will be coming back, so if you're just tuning in, maybe you weren't here last week, we went through that emotional guidance scale and how it's so important to be able to lift ourselves out of low mood and depression. Well, I'm going to give you some very, very concrete tips on how to do that using the emotional guidance scale today. So if you know someone, maybe you're going to share, today's live with them now or even after the fact. Really important that this is something that I'm going to walk through the steps, how to move your way up so that you're feeling better, okay? So this is really important information, but that's coming up. But let's talk about some of the symptoms of fluoride toxicity. So this is, I want you to sort of start thinking, I'm planting seeds, because if you are taking maybe one of those medications that contains fluoride, or maybe you drink a lot of tea that's loaded with fluoride, maybe you've done the treatments especially for the kids, the fluoride treatments in the mouth, maybe you use a toothpaste that has fluoride in it. I gave this up years ago and my family doesn't use it. It's crazy some of the symptoms that are related to fluoride toxicity, and you don't have to take a lot. It's so toxic that you don't have to have a lot of fluoride ingestion or in your system to have an effect on your body, okay? So let's go through some of the fluoride toxicity symptoms. Number one, low levels of calcium, magnesium, okay? So again, affecting those electrolytes in a not so good way. Number two, low glucose levels. So hypoglycemia can be an effect of having that fluoride toxicity. Number three, high levels of potassium in the blood. It's called hyperkalemia. So you go to the doctor. Here's the scenario, because I just want you to think about this. If you know anybody who takes pharmaceuticals, I'm not saying that they're bad. Sometimes they are definitely needed. But however, you've just got to be aware of all of the facts, which I find a lot of doctors don't give you all of the facts. Okay, so let's say you're taking a pharmaceutical for your high cholesterol, okay? And now it comes back in your blood work, your cholesterol, woohoo, yeah, everything's great in your blood work for your cholesterol, but now you have a high potassium. The doctor starts to say, okay, you've got to avoid all these foods that are high in potassium, which happen to usually be very healthy foods, because you've got hyperkalemia. Well, is it because of the medication that you have the high potassium because you've got some fluoride happening in the system? Plus you brush your teeth, you drink tea every day, you brush with the fluoride toothpaste, you've been to the dentist recently. You got to ask yourself, is there any type of correlation, okay? Number four, another symptom of that fluoride toxicity is, of course, you can get mottled teeth. So discoloration in the teeth, which can be related to that fluoride. So I thought fluoride was supposed to help the teeth. Well, not so much. If you have a fluoride toxicity, you're actually going to see some white specks, some brown discoloration on the teeth because of too much fluoride in your system, okay? So this is something that's really scary. Yes, if you're loving this information, hit that subscribe button, hit that follow button. Great to have you all here today. Let's continue in terms of another symptom of excess fluoride. More cavities. I mean, who knew? Yeah, so you're drinking fluoridated water, so you're drinking your tap water, and they told you it was good for your teeth. More cavities, and that's because it's affecting your calcium metabolism. And another big one, okay, here's one of my favorites to talk about, thyroid disorders. If you have a thyroid problem, please, today you have to stop using fluoridated toothpaste. It's a must. And this is what the research shows. It's not just me saying this, okay? So you've got either hyperthyroid or hypothyroid. So overactive or underactive thyroid. You've got Hashimoto's, you've got Graves' disease. This is for you. Fluoride is a big problem, okay? So here we go. The serum fluoride, and this is the study, concentration also had significant relationship with thyroid hormone, free T3 and free T4 and TSH concentrations. And this was a study done on kids that had acute levels of fluoride ingestion. So they studied these kids because they wanted to see, okay, was there a correlation with thyroid health? And surely there was. They tested their blood and they found that their T3, their T4, their TSH was not normal, okay? So what does that tell you? Again, you've got to do your due diligence. You've got to educate yourself, and that's why you're here. That's why you tune in every week to the Dr. Janine Show. I'm so happy to have you all here today. Amazing, amazing. Those correlations are so important in terms of your overall health. Hey, hit that share button, and thank you for all those likes, and I see all of that love happening behind the scenes. Love having you here. Make sure you tune in tomorrow as well, because we'll be doing a quick Q&A tomorrow at 1 p.m. Eastern Standard Time, and that's what we do on Wednesdays. And of course, the show is every Tuesday at 11 a.m. if you're here for the first time, and I know there's so many new people here today. Okay, and we do have one more quiz question coming up, so stay tuned for that, because you have the ability to win a prize from our great sponsors at VitaTree Nutritionals Whole Food Vitamins. Now, what else do we see? Number 7 on the list, breast tenderness. So did you know that fluoride is in the halogen group? If there's any, biochemists or chemistry people out there, and any doctors, of course, I know a lot of doctors watch, and nurses, but you remember from biochemistry, remember the periodic table, remember the halogens, so closest to the end of on the right-hand side of the periodic table, these halogens will displace iodine, and that's why it affects your thyroid when you've got a fluoride problem, but it also affects the iodine in your breasts, and that's why breast tenderness is displaced iodine, potentially because of that fluoride toxicity. Okay, so you have to be aware of these things. Number 8 on the list, joint pains. So if you've got joint issues, and let's go to number 9 on the list as well. So you've got bone spurs, so you've got actually bone protrusions. This is very common in the end of the long bones. So that can happen with osteoarthritis in the knee, that can happen around the ankle, of course with the heel spurs. So if you've got issues going on here, you wake up in the morning and you're feeling like, oh, and you feel the tenderness and things, and you've got pulling on your Achilles tendon, and you've got a lot of issues happening in your ankles, your knees, your hips. This could be related back to that fluoride toxicity. So really, really important that we're addressing this. And of course, was that it on my list? No, I got one more. Poop. Of course, we couldn't do a show without talking about poop. Yes, this is the famous poop bladder diarrhea. So if you've got light floating stools that look like this, does everybody know what I call this one? Okay, take a quick guess. What kind of poop is this? According to me, according to Dr. Janine, please tell me, does everybody know what this is coined? Yes. There we go. Charles Hunt, yes, we're going to talk about tips next week, so make sure you tune in next week. Very specific tips, how to get the fluoride out of your system, okay? And how to do that fluoride detox. Does anybody know? No, nobody knows. Okay, Mary, you're yes. Hansy Braden Smith, you got it. The chicken nugget poop. That's what I call it. So if you've got diarrhea, so floating poops that are not well formed, I've got another one that kind of looks like oatmeal here. I don't know if you can see it. It's hidden underneath there. If you've got those light floating poops, not the best sign. It could be, again, because of that fluoride toxicity. So there you go. Let's talk about now some tips for that muscle cramping. So remember we talked about that muscle cramping, and I hope everybody got that list. Here are my tips for that muscle cramping. And one of the things that's so important, and it's actually quite beautiful. I'm looking at over in the kitchen set is my Electrolyte drink. That's coming up in just a second. But of course, proper hydration. So one of the things that we've talked about before is to make sure you're getting enough water, but actually adding the salt into the water is called Soleil water. And of course, I've shared that recipe with you as well. That is something that's so important, to get that enough salt into your system for that proper hydration, so that your body is actually holding on to that water, because a lot of people drink water and you just flush it right through. Your cells that aren't actually holding on to it enough. So this is something that you definitely want to increase your proper hydration. If you've got a lot of muscle cramping, it could be just dehydration. That's where you're getting the achy muscles and muscle cramping. Okay, number 2 is doing a proper warm-up. So when you're exercising, of course, you got to warm up your muscles, especially the big ones. So your quadriceps, your gluteus, your abs, your back, you got to warm up. So doing a full body sort of warm up, really important. Using all your musculature will help with decreasing that muscle cramping, especially during exercise. Okay, number 3 is you want to fix your leptin and your insulin resistance. So if you don't know what these things are all about, I've got a bunch of content. If you've seen my videos on leptin resistance, put a 1 in the comments if you know now. what leptin resistance is all about, please put a 1 in the comments. I want to see how many of my people have been here for a while. Music Addict, you also knew about the chicken nuggets on the poop platter. I'm very proud of you. Awesome job. Good job. Okay, how many people know about leptin resistance? You've been here before. Yvonne, yes you have. Hutch has been here. Tim has been here. Kathy, of course, has been here. Nadia, ROV, has been here, of course. Eleanor, Leanne, Jade here. Yes, I know so many of my followers. Letty, of course, you've been here as well. You know all about this whole thing with the leptin resistance and why it's so important to fix that leptin resistance, even for the muscle cramping related back to what's going on with your hormones and that leptin signaling. Make sure you hit that like button. Thank you so much, everybody's here. Hey, if you want more information like this, make sure you're hitting that share button and you are subscribed and you are following myself, Dr. Janine. So great to have you all here today. There's so many new people here, which is amazing. Okay, number 4, making the electrolyte drink recipe. Okay, where is it? I've been drinking it, all of it. There's probably hardly any left, but isn't this pretty? I want you to see. I hope the camera can pick this up. So what happens, so what I've got in here, and we're going to share this recipe with you in just a second, but it's water, and of course I've added in a few extra things. So my magnesium, my potassium, I've added in here a bit of stevia, and that's what the drops that has the coloring in it and a little bit of flavor without the sugar, which is amazing. And of course my salt is in here as well. So this is super easy and economical that you can make for yourself. You're going to save tons of money by making your own electrolyte drink, especially if you're active. I give this to my kids as well for their basketball games. I mean, amazing, amazing, and it tastes delicious. You can see it, like I started here at the beginning of the show, and of course behind the scenes I've been drinking it, so let me have another sip. It's so good, and I can't wait to share this recipe with you in just a second. We're going to do that in just a second, right? Okay, yeah, we'll come back to it. Okay, here we go. As well as number 5, for muscle cramping, of course, less medications if you can, the pharmaceuticals. Remember, we talked about the fact that there's a problem with the fluoride that's in so many medications, and this can be related back to that muscle cramping, because that is one of the signs and symptoms, of course, of that fluoride toxicity, is to have that muscle cramping. So if you're getting a lot of muscle cramping, you might want to go and check with your pharmacist if there's fluoride in your medication. You can do probably a quick online check, but some of the meds, I've looked at some of them, they don't always disclose the fact that there's fluoride in them. If you see, remember the word flu, which we saw on the screen earlier, if the word flu is in your medication, that's a good indication that there's fluoride in there, okay? So that's a problem. And number 6, we have fluoride detox tips. Okay, so guess what? You're going to have to tune in next week, and I'm going to go through those very specific fluoride detoxing tips. Now, tip number 1 is just avoid it. So that's one thing you can start today. Like I said, I want you to stop using your fluoride toothpaste. A lot of you are going to have to go out to the store today and get a non-fluoride toothpaste. Even better yet, you can make your own toothpaste, and I do have a recipe for that. Maybe we'll share that next week as well. Yes, I think we're going to do that. Add that to the list for next week. All right, we're going to make my toothpaste recipe, which is amazing, of course, is fluoride free. Okay, let's go on over here, and I want to share the recipe. So if you saw my beautiful fluoride drink, what did I just say? I said fluoride drink. No, what am I thinking? My electrolyte drink. Yes, so this is your electrolyte drink, all natural. Of course, there's no fluoride in here. I don't know what I was saying, but here we go, the electrolyte drink. Here's the recipe. So all you're going to do is, and you can actually do this with either flat and I use reverse osmosis water or sparkling water, so get a good quality water. That's a further discussion as well. I've been doing a lot of research on deuterium lately, so this is something we're going to continue that conversation about deuterium depletion and deuterium in water. But here we go. So you're going to have 2 cups of water, more or less. I mean, depending on how big a container, if you're going to mix this for yourself. And you can add the stevia drops, so that flavor enhancing stevia drops. 2 capsules of the Vitatree Magnesium. Now, what's beautiful about the Vitatree Magnesium, again, from our sponsors at Vitatree Nutritionals, who gives us, of course, all of our prizes for, and we do have one more quiz question, right? Yeah, it's coming up. So yeah, that is amazing from Vitatree because it actually disappears. So I've opened up my 2 capsules into here, and I don't know if you can see that color distinction. Because it's alkaline and the stevia drops are a little bit more acid, I guess, it makes this color change when you add it in. So it's really cool and it's fun with the kids. It's like a science experiment when you do this, okay? All right, so 2 capsules of magnesium, which of course is one of the big electrolytes that you have to have balance with in terms of that muscle cramping. 1/4 teaspoon of cream of tartar, and this gives you your potassium, okay? So now remember, if you've got hyperkalemia, if you've got too much potassium in your blood, blood, remember that's a sign of fluoride toxicity. So I don't want you to be scared of potassium. You got to maybe check out the meds that you're taking, or if you're drinking too much tea, or you're using, fluoride toothpaste, why your potassium may be high. But this is giving you potassium, which is really important to get into your muscles as an electrolyte, okay? And a 1/4 teaspoon of salt. And I use the one from Utah, loaded with all those minerals, which is amazing. You're just going to mix that into your water and enjoy. And you can bring this, to your game, on the road, you're sitting on the bench, you're having an electrolyte drink, saving you tons of money. Because when you buy, of course, the prepackaged electrolyte drinks, not so great. They're loaded with sugar and artificial color and all these things, not so great. Okay, so I want to say thank you to all my super fans, to everybody who tunes in every single week and throughout the week as well. Thank you so much. You guys are, many of you, and I can't call you all out, so I thank all of you. So many of you are actually donating to the channel, and I love you all for that. And at the very least, please hit that subscribe button, that share button. Make sure that you're following to help to support, of course, the channel and everything that we do here at the Dr. Janine Show. We put a lot of effort and time and energy and money into producing these great high quality shows for you. And I hope that, and I know that you appreciate it and all the information that we share. Okay, let's talk about oil pulling. So we started the show talking a little bit about the benefits of oil pulling. Now, oil pulling is the traditional Ayurvedic method of taking some coconut oil, and traditionally sometimes sesame oil is used as well. I'm not as a big fan of sesame oil being a seed oil. There's, depending on where it's coming from, and there could be some, if it's very refined, maybe not the best type of oil to use. But some of the research is actually specifically done on coconut oil, and you want to use a good quality coconut oil. And our final quiz question is coming up, so I just want to remind you all about that. So don't go anywhere, but this is really important that you're finding a good quality coconut oil, and we talked about it. So if you missed last week's show, we talked about all of the things to look for in a high quality coconut oil, but that's one of my tips, okay? So that's number one. Ideally, it's in a glass bottle and it's not fractionated, and those are the things that we talked about. If you do need to refer back to last week's show, you can definitely look for, my tips on choosing the right coconut oil. Okay, then you're gonna use a teaspoon to a tablespoon. So if you're doing this for the first time, do not go for a full tablespoon. That could be a little bit too much of a sensation in your mouth. I'm just going to say, learning from experience, it may not feel, very pleasant to put too much coconut oil in your mouth for the first time, okay? But a little teaspoon is a great way to start if you're new to this. And then all you're going to do is you're going to swish it in your mouth. And you're going to do that for 5, and if you're just starting out, just for 5 minutes, or as long as you can, okay? So, traditionally you could do this up to 15 minutes. You're walking around the house, you're doing whatever you're doing in the morning, you're meditating, whatever. 5 to 15 minutes. Hey, if you get to 1.5 minutes, that's good. You're gonna feel some benefits from this, okay? So for more information, as such, please make sure that you're hitting that subscribe button. Love the fact that you're all here today. So many new people here today, which is amazing, okay? And El Credo wants me to show how to make the toothpaste. Okay, I promise we will show that recipe next week, okay? How to make the natural toothpaste, which is whitening as well. Okay, then what we're doing is number 4. You're going to spit it out in the garbage, okay? In the garbage. You're not spitting this out in your sink. You're not spitting this out in the toilet. Garbage, okay? What is the reason for that? Well, there's a few. Number 1, you don't want to clog up your drains, okay, because it isn't oil, and you don't want to clog up your drains. Number 2, think about what you're spitting out. What you're spitting out is a lot of those pulled toxins, and this is what the research is showing now. And a lot of experts that deal with Lyme disease and toxicity in terms of aluminum toxicity, they talk about the fact that oil pulling is really advantageous, and this is what they do with their patients who don't get results, in conventional medicine, that are able to use the oil pulling to help as part of the protocol to pull that aluminum and that glyphosate and all these toxins and these pesticides out of the bloodstream through the mouth, and you're spitting it out because you don't want to put that fluoride, that aluminum, that glyphosate back into the water system by flushing this down your sink. Does that make sense to you why we are using? So just FYI, future quiz question coming up on this, okay? Not today, but another time. I'm going to get you with this one. What do we do after oil pulling? You're going to remember that. Okay, I hope that sticks in the brain. Here we go. And then your last tip is you're going to rinse out your water. At this point, you've spit out all of the oil, okay? Then you're going to rinse out your mouth with a little bit of water, and then you can spit that out into your sink, all right? Or into the toilet. It's totally up to you. There you go. I hope you've got those tips. I hope that helps. Start your oil pulling. I'm telling you what this does to whiten your teeth, pull out toxins. It is amazing. Now, I do want to review. So something that we talked about last week was our emotions and how this affects our health, much like what we talked about earlier today, how all of our teeth also affect our internal organs, affect our overall health. These are the connections and the links that I make because it's so important that you're able to make these connections for yourself. This is not what usually mainstream medicine is talking about, not even what natural doctors often talk about. You want to definitely do your best to tune into and tap into. And I want to help you. And we're going to go through an exercise that you can play back to yourself at a future date and take notes on this, but we're going to do this together and you're going to just listen and pay attention, okay? Here we go. The emotional guidance scale is a guidance system, okay? Not so good emotions at the bottom, best emotions at the top of this guidance scale. And this is very dynamic. This is very changeable. And we're never always right here, okay? That's not what I'm saying because that's not attainable. And I've actually spoken to, joy and happiness researchers and experts in the fact, an actual doctor of happiness, and she says it's not realistic. Not everybody is up here, happiness, joy, freedom, bliss all the time. It's not attainable. It's not possible. We're human. But the fact that we can be down here a lot of the time, not so good either. So what we're going to do is an exercise now, how to move up the emotional guidance scale. This is always the goal, is to go up the emotional guidance scale so that we can get healthier, get happier, because remember, our emotions are mapped and are very much connected to our internal organs. So getting sometimes out of, bad medical situations, we got to start here. We got to start with that mind-body connection. That's what I'm all about. All right, now I do have a Q&A coming up in just a few moments as well. So if you've got those burning questions, stick around for just a couple more minutes as well. But also, tomorrow we will be doing a Q&A. Okay, so tomorrow at 1 p.m. Eastern Standard Time, please make sure you tune in tomorrow, and I'll be answering more of your questions then. Okay, so the whole thing about the emotional guidance scale is that you've got, and the bigger tip is to always choose a thought that's a little bit better than the previous thought. So for instance, you're feeling down in the depths of despair. You're feeling depressed today. This is something that, yes, okay, you are recognizing that feeling. So an example, you say, I'm feeling depressed today, nothing goes my way. Okay, so we know you're at the bottom of the scale. Now, what you can do to make yourself feel a little bit better is that you say to yourself, I'm feeling angry that I can't control my emotions. Okay, so anger is above the depression, the despair, the fear. I'm angry. So when you're feeling angry, it's actually healthier than being down in the depths of despair. Is this making sense? Yes, I'm hoping I'm seeing some people, yes, they're nodding your heads. Okay, now, after that anger, then you can say, okay, I'm feeling overwhelmed by all of my problems. So now you've lifted yourself out of the anger. Feeling overwhelmed is a much higher, better on the emotional guidance scale emotion versus that anger. Okay, now another example is, okay, I'm frustrated. I'm not, able to do anything. I can't find my solutions to feel better. This is something that we definitely want to come up in terms of that frustration. We want to be a little bit better than overwhelmed. Then we're going up. Okay, so are we contented? So can we get yes, now here we go. I'm feeling content that I'm able to recognize my shortfalls without any judgment. So you're not going to judge yourself. I'm content that I can recognize that, I've got, some shortfalls, but I'm not going to judge myself. Okay, so does that make sense? Yes. Okay, and I want you to play this back to yourself because you're not going to get it in the moment. And maybe you're feeling great today. Maybe today's not a bad day. Maybe you're up here today. But on a bad day, you can play this show back, and this will help you to walk and talk yourself through this exercise. Okay, then here we go. Happy. I am happy to know that I'm a human and I can experience a vast array of these emotions. Yes, we can all say that, right? it is a wonderful thing, absolutely, to be able to feel all of these different emotions. So I'm happy about that, which is good. And then moving up again, I'm passionate about helping others to feel more empowered over their emotions. But guess what? When you're feeling down in the dumps and crappy, what you can do is reach out and help somebody else. Guess what? You will instantly feel better yourself. And at the ultimate, at the top, joyful. I'm so filled with joy that everything goes my way. And it wouldn't be nice if every day was like that, but we can attain that. We can get towards feeling better and better. No, not every day is going to be perfect, but we can move and pull ourselves out of those depths of despair and depression by using that emotional guidance scale. I hope everybody appreciates that and take it to heart. Use these tools because I know there are challenging times for all of us, and to be able to pull yourself up is what health is all about. Okay, now, let's talk about quiz question number 3. Yes, it is time. Okay, so this is your chance for today. Last quiz question of the day. We are playing for the VitaTree Nutritionals, vitamin B12, whole food vitamins. Okay, we thank VitaTree for being our great sponsor. Are we ready? I hope everybody was paying attention to that. Here we go. Quiz question number 3. According to the emotional guidance scale, anger is better than depression. All right? True or false? Everybody put in your answers now. It is a true or false. Here we go. True or false? Please get your answers in. All right, you got about 20 seconds left. All right, about 5 seconds left. And 1 second left. Did everybody get their answers in? I hope so. Yes? All right. Okay, let's reveal the answer, of course. Is true, yes. So going up that emotional guidance scale is something that's so important for your overall health. And let me tell you, when you're feeling good, disease and all of these negative things that can happen to our cellular metabolism do not have a place in your body. And maybe somebody needs to hear this. Maybe you need to share this with someone who needs to hear this information. Okay, so if you're just tuning in today, we have talked about so many wonderful topics. We talked about fake B6 vitamins, okay, and what to look for on your labels. We also talked about oil pulling. I know a lot of you have a ton of questions about that oil pulling, and tips for depression, of course, which we just went through that emotional guidance scale, that muscle leg cramping, and of course, fluoride toxicity, which I promise next week we will be talking about tips, how to decrease that fluoride oil pulling. I know a lot of you behind the scenes have asked about this, so let's talk about this really quickly. So helps to reduce that bad bacteria and plaque in the mouth. It does help your mouth microbiome, which is so important. Helps that bad breath, reduces inflammation, decreases cavities, helps to whiten your teeth, which is amazing. Detoxes aluminum and glyphosate from your body. So as you know, on the bigger scale of things, it is a detox protocol, and that's what we talked about last week with spring detox and tips. We add this to the list. Now next week we will talk about that, how to detox specifically the fluoride from your system, and I've got a bunch of tips for that, so make sure you tune in next week, which is going to be amazing. Sunshine Mumsy, thanks for tuning in. It's so great to have you here. Pink Rocks, amazing, amazing. And how often are we doing the oil pulling? Every day if you can. And again, you'll become more comfortable with doing it the more that you do it. So every day, once a day is perfect. I hope that helps. Okay, thank you, Sue Lynn, for sharing today's live. I think you shared with like at least 5-10 people. Amazing, amazing. Raina, you're the best. Thank you for tuning in. And the list of medications. And we will post that. So the post of the list of the medications that contain fluoride, are going to put that on a post for you. So make sure you stay tuned for that. And we'll get that out to you so that you can see that list because now it's gone. And I've got to be gone too. So thank you to everybody who tuned in today. Make sure you tune in tomorrow. Remember tomorrow, Wednesdays at 1 p.m. Eastern Standard Time. You can ask me your questions. I do have to go. Love you all. Thanks for tuning in. What a great show. And if you missed anything, make sure you can check it out again on long form. And we'll see you next week as well, but we'll see you tomorrow at 1 p.m. Have a great day, everyone.